Winnipeg Mayor Scott Gillingham has long called for a fourth emergency line that would be dedicated to responding to wellness calls, mental health calls, so that police are not the ones doing that, which some say that can actually escalate a situation. So the mayor announced today in a release that he is moving forward with putting together a motion that he's going to present to the Executive Policy Committee later this month. And from there, if it gets approved, then they actually have to go through the work of putting together a proposal. Winnipeg Police, year after year, at least for the past 5 years, have the number one calls that they receive are wellness checks. And so they're the only ones that you can really call if someone is in a mental health crisis. And so they may show up. They do have the authority to detain someone. They're the only ones that have the authority to detain someone under Manitoba legislation. And they maybe bring someone to a hospital or to a mental health facility, and they're the only people that are designated to do that. So some calls, can be as simple as they show up, they speak with the person, and the person goes on their way. It can escalate to where they're having to detain someone for their own safety or for the public safety. And then it has escalated from there where there have been unfortunate police shooting deaths. There are places elsewhere in Canada and in the US that do have a line dedicated to responding to mental health calls. So Toronto piloted a project a few years ago that the city has made permanent. You can call 911 and a call will be, if it's a mental health related issue, will be diverted to a specific team to respond to those calls. As well, in different parts of BC, there are, it's the same, they have the same thing where it's a little bit different because you can't call 911, but you can call a different number if you're having a mental health issue or if someone is calling on behalf of a family member. And they'll send designated experts or designated workers in the field to respond to those specific calls. So it's and then there's some other similar models in the US. So it's not a new idea, but certainly has been top of mind, I think, in the general public conversation over the past couple of years as, mental health crises have been on the rise.